Morning, everyone. Thanks for joining us today. Money pays for health care, so let's talk about money today. 4 years ago when we came to government, we inherited some enormous debts, and we thought that we had a problem to clean up, but we've got a new problem. We are the most indebted province per capita in Canada. Last year, we paid a record more than $1 billion in interest on our debts for the first time in the history of Manitoba. And all of those taxes go to moneylenders. They do not go to frontline services. They do not fill a pothole. The burden our children and grandchildren are going to inherit is large, and let's be clear, it is about to grow. The COVID-19 pandemic has shut down the economy, and Canada's strong economy has always paid for Canada's strong healthcare system, but not today. Governments have always used the taxes that you pay when you buy things, when you work, from your small business to pay the bills. But that isn't going to work now. And so now governments are struggling to find the money from other sources, from somewhere else, while the economy suffers. And borrowing more money for Manitoba's future, from our own future, and from those generations who follow us is, frankly, the only way we're going to get the money we need right now. Borrowing from those we love, borrowing from those we care for, most of all, so that we can provide for those we love and those we care for today. That's where we're at. Let's be honest about it. So, Manitoba's about to take on, as are all the other provinces, some new debt. I call this Manitoba's pandemic second mortgage. Every province is in the same situation. We've worked diligently for the past 4 years to build up a rainy day fund. We're using that now. We worked hard to build it up, and it's going to dry up. And when it does, Manitoba's borrowing will begin in earnest, out of necessity. The facts are these. Every province will be looking for money at the same time, and that's going to drive up our costs even further. Every province already pays more than the larger federal government does to borrow, and those differences in interest costs will widen. And Manitoba will pay double or maybe even triple the federal government interest rate on its second mortgage. So here's a Manitoba idea, straight from the friendly Keystone province. The federal government should act as the intermediary for all provinces in their borrowing. They should coordinate this national emergency response. They can borrow at much lower rates, and they can pass those savings on as a service to Team Canada. Le gouvernement fédéral pourrait servir d'intermédiaire et coordonner cette urgence économique nationale. Ils ont pourtant des taux inférieurs et peuvent répercuter ces économies en tant que service à Keep Canada. This could save Manitobans, for example, in excess of $1 billion in just the next 10 years. This Federal Emergency Reserve Savings Team concept would be the first of its kind in Canadian history. A common sense, friendly Manitoba suggestion. Lower interest payments mean more money for health care, now and in the future, and a lower burden on future generations too. The choice is simple: stronger banks or stronger health care. Moins d'intérêts signifie plus d'argent pour les soins de santé et est un fardeau moins lourd pour les générations futures. Le choix est simple. Banks plus solides ou soins de santé plus solides. I know Manitobans agree. I know experts agree. I know all the premiers agree too. I know the choice is clear to all of us. First pandemic, first solution. The Federal Emergency Reserve Savings Team is good for our country and for all of us and for future generations as well. After all, we are all in this together, all provinces and the federal government. We are, and we must continue to be, Team Canada. And together, we'll beat this thing. I'd be happy to take your questions.
Thank you, Mr. Premier. First up from Global, Brittany.
Good afternoon, Mr. Premier. This was something that you had announced last week, and I'm just wondering if you've already had a conversation with the Prime Minister about this and where that's gone so far.
Well, I would say, first of all, we've had the conversation as recently as Friday, Brittany, but not since, and I wouldn't want my comments to be taken as accusatory to the Prime Minister for not responding more rapidly, because he's only really been aware of this proposal, I expect, for a few days. But again, it just makes such good common sense. The chance for us to save money on interest and the chance to redirect that interest into healthcare is what we're talking about. So I'm very hopeful the federal government will respond favorably. All the premiers that were on the call, all the premiers, quite frankly, are unanimous that this is a service that they believe can be very helpful to them. And of course, to varying degrees. Different provinces have different fiscal situations and fiscal needs. But the point is that the money saved can be used either to strengthen the bank's balance sheet, or it can be used to strengthen our ability to provide health care to our citizens.
And my follow-up is on masks. 3M is located just south of us across the border. Premier Doug Ford in Ontario coming out already saying that they've seen masks that were stocked at the border. What are we seeing here in Manitoba, and what's your message to those south of the border on stopping any shipments of those masks coming to Canada and to Manitoba?
Well, Brittany, I know that the doctor will have more to say to you in less than an hour on specifically on protective gear and equipment. I can only say that I think I understand, and I hope that most Americans understand, as we do in Canada, that our trading relationships over the years have been some of the best and strongest in the world, and that we should never let that border thicken, because quite frankly, we build things together more than we build them separately. So I'll always be concerned when I hear comments such as those from the President late last week.
Thank you.
From the Winnipeg Free Press, Larry.
Mr. Premier, Larry Cush at the Free Press. I'm wondering if you've given any thought to what at least one province is considering, that is the topping up of assistance, direct assistance to people on EIA during this crisis. Is Manitoba about to announce something along those lines?
Well, Larry, we have, in terms of topping up, we have a program that the federal government has kicked off this morning at 6 a.m. to provide up to $2,000 a month for people who don't have other sources of income. And within our public service, we have some of the most generous contracts for vacation pay and for sick time in the country. So, I wouldn't want my comments to be taken as anything representing a lack of appreciation for our workers in government, but I would say that our supports in existence today, plus the federal plan that we'll be encouraging participation in for those who need it, combined offer a tremendous base of security and confidence for people, in particular in the public sector.
People on welfare.
Well, again, the province of Manitoba has never had a budget as large as this government has for people on social assistance. That's one of our largest and fastest growing categories of expenditure in our provincial budget. We've almost tripled the amount of money available to support people in respect of rent. The Rent Assist program itself, we anticipate, will be significantly increased in its subscription and is, as I said earlier, just about not quite triple what it was when we came to government. So We've continued to direct resources to our more vulnerable people. And that was, I think, in part the theme of our announcements on our programs last week as well. Late last week, we announced programs to offer some greater, we hope, confidence to those, in particularly the most vulnerable in our society. And that's where our focus will continue to be.
But just to follow up, so you're not looking at increases in social assistance rates at this moment?
As I said earlier, we have some of our largest contributions, and certainly larger than any previous government by a significant amount, are going to those on social assistance right now. But there are also a great many other Manitobans who need help and support, whether it's frontline healthcare workers or people in the private sector who've lost their jobs, small businesses that have gone, been forced to close down because of our decisions to protect the health and well-being of all. We're all in this together, and there's lots of pain to go around. I understand that. But again, our focus has been on continuing supports and growing supports for those who are more vulnerable in our society, and we're continuing to do that with, for example, the announcement of additional secure spaces for homeless people last week and that type of thing.
Thank you.
From the City News, Stephanie.
Good afternoon, Mr. Premier. Stephanie Lasuk from City News. We continue to hear concerns over people not self-isolating when they return from travel. I'm just wondering, is it time for Manitoba to look at stricter enforcement like some other jurisdictions have done?
It's a topic of discussion earlier today, and it continues to be a concern, as I expressed probably too bluntly late last week, but nonetheless, it is a concern when people refuse to understand the hurtful consequences of their thoughtless conduct. And so, yes, it is on the radar to see if there are necessary deterrents that need to be pursued because of this. Sadly, that's necessary given the reality that some are disrespecting the rest of us. Most are not, and I think it's important to remember and to take pride in the fact that most of our people in this province are tremendously respectful of one another and have been behaving accordingly, but sadly not everyone seems to be getting the message.
And just as a follow-up, what is currently being done? How many fines has Manitoba handed out, or what is currently being done to enforce the public health order?
Mm-hmm. Yeah, well, as you know, we've had the call number, and we've had some input there, and there have been some follow-up, and inspections have been done. But I think you're raising a very fair point, and I think Manitobans expect now that there should be consequences for people that are being disrespectful to them and to their friends and their family, and to, frankly, the battle against COVID-19. So we're definitely taking a look at some additional steps, sadly.
Thank you.
From the Canadian Press, Steve.
Premier, it's Steve Lambert from the Canadian Press. There's a media report out of Quebec today that says Manitoba and Alberta have offered to send some personal protective equipment, masks and the like, to Ontario and Quebec to help out because their numbers are much higher. I'm wondering, is that true, and what, if anything, have you offered to Ontario and Quebec?
Well, the doctor may have more to say on the specifics of this, Steve. It's I must be frank, it's not to my knowledge been the case, though it has been at many times throughout Manitoba's history the case that we've stepped up and helped others, and we'll continue to be proud of that. But I'm not aware of the specific nature of any assistance at this point in time.
Okay, and as a follow-up, a number of groups have raised, a number of healthcare workers and allied healthcare workers have raised concerns about personal protective equipment that they're getting, especially in the field, those people who don't work in hospitals or nursing homes or other facilities, home care workers and the like. What assurances can you give them that at a political level that you will do what you can to ensure that they are given proper equipment, that they are given access to it and can change it as they work outside facilities such as home care workers going into people's homes?
Yeah, I think it's totally understandable that people are concerned about their personal well-being. So am I. And so we've been on this one from the get-go. As you know, we were the first province to sign on to the federal procurement initiative and placed our order early before everyone else. We're following other avenues as we need to expand on availability. Our concern is not just with those who are vulnerable because they've contracted COVID, but also with those who are trying to protect those people and do their best on the front lines of healthcare. So we'll continue to be focused on making sure that we do everything as a government that we can on a planet where virtually every single jurisdiction is after the same thing, which is greater protective, more protective equipment for their workers. We are doing the same and have been for some time. So we'll continue to do our best, and we'll hope it's not needed. I guess everyone hopes that. But we're preparing for worse than that.
Thank you.
From CTV Winnipeg, Jeff.
Hi, can you hear me?
I've got you, Jeff.
Sorry, I'm having troubles here. Mr. Premier, you said taking a look at some additional steps, sadly, with regards to social distancing penalties. Can you maybe elaborate?
Well, I'll elaborate later in the week, I think, Jeff. First, we've got to get our ducks together in terms of the rules and the constitutionality and the various and sundry requirements that we have to meet to be sure we're doing this properly. But there's a clear need. And I think, quite frankly, you know, look, Manitoba, springtime, there's going to be some challenges out there. We all know that. This is a beautiful place in the spring, and people are going to want to get out. People are talking to me about cabin fever left, right, and center. They're going to want to get outside. I've seen in several parts of the city and around the province, I've seen more people walking than I've seen in years. And not everybody is necessarily religiously adhering to their guidelines. So there's going to need to be some coaching and guidance beyond the doctor and I and Ms. Siragusa every day telling you and repeating these messages. We have done some advertising. I know that many of the community groups out there have been advocating. They've been doing their best to educate people within their jurisdictions. We talked about this actually with some of the Manitoba municipalities as well. They're making efforts. So, you know, all of us are on the team. Not all of us are behaving as if they are, though. And so measures are going to, that can assist in that happening or what we're looking at, and I'll have more to say in the not too distant future on that.
Okay, so my follow-up would be, are you looking at fines, mandating orders for people to stay home like we've seen in some states? And I mean, I don't know what every other province is doing, but I mean, are you looking at things like that?
Well, we're looking at what works, but at the same time, we don't want to adopt a practice that forces everybody to be treated as if they were less intelligent than and respectful than they are. So let's put it that way. It's a tricky thing, isn't it? We don't make laws for the vast majority of people because they abide by respectful conduct without being told to. They don't need a law to tell them what to do. Unfortunately, for some people, I guess that a financial penalty or deterrent of some kind is about the only way it'll click into them that they matter and that what they do matters to other people. So we'll have more to say on that in the not too distant future.
Thank you.
From CBC Manitoba, Bart.
Bart Lakiva, CBC. Mr. Premier, on Friday you hinted about closing the border with Ontario, potentially to keep people from going to Lake Country there, as people there have requested. And you've just mentioned about outdoors here. What are your plans? What is your desire? Makes sense in terms of Manitobans going to their cottages, trailers, the lake in general? There is already some consternation in cottage country about that. Could you please offer your thoughts?
Well, my thoughts are, and I'm sharing them with Manitobans, but I'm sharing them with a journalist who has an extensive love of the outdoors and has demonstrated it through his work over many years. This is This is a very, very tough issue to deal with. We have families that have been in close confines for now weeks who want to get away and to enjoy the beautiful things that nature offers us here in Manitoba, and perhaps for many Manitobans as well, northwestern Ontario. It's a difficult issue. My plan is to have some input from Premier Ford on this as well, to see where he thinks we should be going. You know, our number one concern, of course, has to remain and must be the containment of COVID-19. And so that is where the focus has to lie. And whether it's talking about parks use or leisure space use within the cities or travel. Dr. Roussin, I'm conjuring up right now, has always been saying, and will say again today, stay home. Stay home and be safe there, because this virus travels when you travel. And if we can contain it that way, and the fight that we're fighting is ongoing, it's not a sprint, it's a marathon, that's the best thing to do. In the short term, there is pain, much pain to go around, but the rewards are there for following the guidelines the doctors outlined. So I would continue to urge Manitobans to do just that.
And that's a follow-up to that, involving travel strictly within Manitoba. If once it's warmer, what do you think about people going directly to a park and not dealing with other people there, or directly to a cottage and coming right back within Manitoba, inside our borders?
Yeah, well, again, you're talking to a guy whose favorite leisure activities are pretty much all outside. Maybe that's a natural consequence of being inside all the time. I think a lot of Manitobans could relate to what I'm saying right now. And so making sure we balance that ability for Manitobans to have some freedom to recover from the confinement that they and their family members are forced to have right now is an important aspect of these considerations. Health is the number one concern, though, and the transferability of this virus in our parks and elsewhere in our wilderness areas and so on has to be a major concern. So balancing those two things is not an easy deal. I guess that's why I got this job, so I have the chance to make everybody angry when we make decisions.
Thank you.
You bet.
From 102.9 CHTM, Navi.
Good afternoon, Mr. Premier. Navi Ball with 102.9 CHTM. I believe a couple of weeks ago you expected the rainy day fund to be depleted in about 3 months or less. Is that still on track for that, or have there been changes?
I would say that's as close as we're getting, and that hasn't changed significantly at this point. However, there are so many moving pieces, I'm hesitant to give you a hard and fast rule. It would be like the Ontario numbers you saw last week with a 500% disparity from top to bottom estimates. Nonetheless, thank goodness that we set aside that money and it's available without having to bang a tin cup and go to lending institutions. We've got that money available to allocate to things like purchase of protective gear and equipment. We've got it available on short order, and it's being used. But we do anticipate it gives us a bit of a margin. But then what happens after is why I'm raising this issue today, and why I'll continue to raise it. It's a practical, common sense way for us to reduce our interest costs. Just every Manitoban who's ever negotiated on a loan, paid a credit card bill, or has a mortgage understands how important it is to reduce your interest rate on your debts. And I hope the federal government understands that that's important for provinces as it is for the federal government as well.
Mm-hmm. And are you able to speak to how much is currently in the rainy day fund, even just a percentile?
I can tell you that it started higher than it is, and it's going to go lower than it is now.
Okay, thank you.
You bet.
From CBC Radio Canada, Patrick.
Bonjour, Mr. Pallister. Patrick Foucault from Radio Canada. Just to follow up on Steve's question on helping other provinces with medical supplies. The reports in Quebec say that during that Premier's meeting last week with Prime Minister, you said you had the intention to redirect personal protection equipment to other provinces with greater needs. I understand you say you're not aware of any deal or shipment at the moment, but did you and Premier Kenney from Alberta said during that meeting that she had the intention to do so?
I've answered this question previously. I think you're dealing with a false report, and now you're alleging something was said in a conference call between premiers and the Prime Minister, which would require you to have bugged the call. So I hope that wasn't the case. I wouldn't think CBC would do that. That being said, I said earlier that no such assertion was made by me. The doctor may be privy to some other offers of equipment I'm not aware of. And Dr. Roussin, I'm sure, would be happy to answer that question if you ask it later on.
Okay, thank you very much.
Parfait.
From the Winnipeg Sun, Josh.
Good afternoon, Premier. This is Josh Aldrich with the Winnipeg Sun. Looking at that rainy day fund, rain, I guess, kind of being the big word here. We had quite a dump of precipitation on the weekend, and we're getting into that thawing season with potential for flooding. How much more pressure would a big flood put on that fund? How much does that make it that much more important that we have the funds available from the feds or from loans for that money?
Well, it is very important that we have the support from the feds on this model that Manitoba is proposing and that the premiers unanimously support, but I wouldn't want to use the potential for a flood to make my case. I think the case is made on its own basis, its own merits, and our flood projections are, with a plus minus always. We're talking about Mother Nature not showing us in significant danger. That's no reason to be anything but prepared, and we are prepared. We've had good cooperation. Our Minister of Municipal Affairs, our Minister of Infrastructure have both, as recently as Friday, been on calls, as was I, with all the representatives in the rural municipalities. Obviously, this is a concern. They're the front line when it comes to defending us against flooding situations, and I commend them. I think that both my ministers and the municipal officials are doing a great job of staying in touch and being proactive on addressing the potential dangers.
And you said earlier that we've relied in the past on the economy to be supporting healthcare, not necessarily always the government supporting that. How much longer can we support that just on government funding? How quickly do we need the economy to get back going to support not just healthcare costs, but other initiatives out there to support people through this pandemic?
It's a real good observation you're making. I mean, with a strong economy, we can support the existence of government programs. With a weak economy, we borrow, and that borrowing in the past, excessive borrowing, is what we've inherited, which gives us, significant debt obligations for us and for the next generation. So, what we're attempting to do here is make sure that we're not just addressing the immediate needs for healthcare, but that we're also understanding that with the right approaches, such as we're recommending now, that we can strengthen healthcare for the future too. I mean, really, the choice is about whether you want us to pay more and have stronger banks, or whether you want us to pay less and have stronger healthcare delivery, because the provinces lead in the delivery of healthcare. And look, the government doesn't print its own money. There's not a tree in the back of the legislative grounds here that pops out money every spring or fall. The reality is that people pay taxes, and that money comes from our economy and from their willingness to work hard and to give up a share of what they make to help us support our social programs. So when the economy suffers, healthcare sustainability suffers right along with it. And we want to do our best to make sure that the short-term, mid-term, and long-term needs for healthcare are well served in our Canadian Confederation. So this is about building a stronger Team Canada, and we think it's an idea that has a lot of merit.
From CJOB, Diana.
Good afternoon, Mr. Premier. Diana from 680 CJOB. Western Surgery Center is a state-of-the-art facility on Sterling Line Parkway. It's one of the best and most modern healthcare facilities in the province. It's currently closed, but we're hearing it's been offered to Shared Health to kind of deal with non-COVID cases right now, and could actually handle patients staying there overnight if the government instructs the College of Physicians and Surgeons to allow them to do that. Why isn't that being done right now, and why are these kind of outside-the-box ideas being considered right now to get the best health care into the hands of Manitobans who need it during the pandemic?
Diane, I can't speak to the specifics of the facility you raise. I can only say we put out a call for help and have had literally hundreds upon hundreds of responses from Manitoba facilities, professionals, businesses, manufacturers, in terms of service needs, in terms of machinery, equipment needs. Dr. Roussin might be able to answer your specific question on the facility you raise, but I can only say that the response from Manitobans and from the companies they represent or that they are part of, and from individuals as well, has been really, really heartening. So I thank Manitobans for that, and I think that's definitely an indication of the kind of people we are here in Manitoba, that we rise to the challenge together.
And just as a follow-up then, obviously you said you can't speak to specifics in this case, but would it be a consideration of the province to use a facility like this? I know obviously you have the RFP out for hotels for kind of similar purposes. Would you be looking at maximizing the use of kind of clinics like this?
Yeah, we're definitely looking at maximizing our partnerships with other providers, not just with central government or the people who work within government, but with private sector people as well, and volunteers as well. As you know, with the Help Next Door initiative, we've had thousands of Manitobans step up, and they're really doing a wonderful job, and I say thank you to them again as well. So no, creative partnerships with the private sector is obviously something that'll help us to be more resilient and to not just get through this, but move forward and watch our economy recover more rapidly than, well, perhaps some other jurisdictions may.
Thank you.
You bet.
And finally, from the Brandon Sun, Colin.
Hi, Mr. Premier. Colin Clark with the Brandon Sun here. I was wondering if the province is considering offering any direct support for municipalities hit by the pandemic.
Well, we maintain, and we had the great call with the AMM again the other day, we maintain some of the strongest support for municipalities in the country of Canada, and we have no intentions of changing that approach. Those are great people that work at the municipal level, whether on the staffs or the elected people. I've often said to the people who serve in the councils, whether it's in the city of Brandon, Westman, or right across the province of Manitoba, that they're the best deal taxpayers get, because they are right on the front line. They're hearing from people about their issues and concerns, and I think this is a good opportunity for me to just say thanks to all those folks that are out there doing that right now, because they're dealing with a lot of issues, not just COVID, but they're dealing with a lot of other issues on a daily basis, and so we thank them, and we've really appreciated their partnership. So we have no intentions of reducing our funding support for them. And I should mention too, just the initiatives we announced the other day, for example, taking the property tax, the PST off the property tax, is going to add some significant savings to rural municipal governments and give them a little bit more money to deal with some of the additional challenges that they're facing and that we're all facing, quite frankly.
No follow-up question. Thank you.
My pleasure. Just want to say thanks again to everybody. I'll have more to say on a couple of other issues tomorrow, but I do say again, thank you for your reporting and thanks for your work. And to all Manitobans, stay positive, stay together, keep listening to Dr. Roussin and Ms. Siragusa and do what they've asked you to do and encourage others to do the same. And together we're going to beat this thing. Thank you.